Are azithromycin and clarithromycin the same? No, azithromycin and clarithromycin are not the same. Although they belong to the same class of antibiotics known as macrolides and have similar mechanisms of action, there are some key differences between the two. One major difference is their chemical structure. Azithromycin is derived from erythromycin, while clarithromycin is a derivative of erythromycin as well. However, clarithromycin has an extra methyl group, which gives it increased stability and a longer half-life compared to azithromycin. Another difference lies in their spectrum of activity. Azithromycin has a broader spectrum, meaning it is effective against a wider range of bacteria, including certain gram-positive and gram-negative bacteria. On the other hand, clarithromycin is more potent against certain gram-positive bacteria, such as streptococcus and staphylococcus species. The dosing regimens for these antibiotics also differ. Azithromycin is often prescribed as a once-daily dose for a shorter duration, typically 3-5 days, making it a convenient option for patients. Clarithromycin, on the other hand, is usually taken twice daily for a longer duration, depending on the infection being treated. Both azithromycin and clarithromycin have similar adverse effects, including gastrointestinal issues like nausea, vomiting, and diarrhea. However, clarithromycin has a higher potential for drug interactions compared to azithromycin, as it inhibits certain liver enzymes responsible for metabolizing other medications. To summarize, while azithromycin and clarithromycin are both macrolide antibiotics, they have distinct differences in terms of chemical structure, spectrum of activity, dosing regimens, and potential drug interactions. It is important to consult a healthcare professional to determine the most appropriate antibiotic for a specific infection.